Hello friends, welcome to a new video. So today in this video, I will going to discuss with you all about a very important topic that we all should know. So I'm telling about myopia control. So myopia is commonly known as nearsightedness. It is a growing global health concern and particularly among children and adolescents. So in this presentation, I will go into the various strategies employed to control the progression of myopia, focusing on methods such as lifestyle modification, optical intervention, and pharmacological treatments also. So we will start by understanding the prevalence, impact, and all such things about myopia. Then we will go into deep about how myopia actually progress, and also we will take a look into some innovative approaches in managing this condition that can include atropine eye drop, myopia control lenses. All these things we are going to cover in this presentation. Okay, so by the end of this presentation, I hope to provide you with a comprehensive understanding of the current advancement in myopia control and how this can be applied in both clinical practice and everyday life to preserve the visual health. Okay, so let's start. So here, what is myopia? Myopia is a type of refractive error where the parallel rays of light which are coming from infinity get focused in front of the retina instead of focusing on the retina. That is myopia, right? So here in myopia, the patient or the person who is having myopia feel difficulty to see the distant object clearly, but he can see the near object. So the person with myopia having this problem, and the prevalence of myopia globally is this 22.9%. Okay, and also, apart from it, I want to tell you that a 1 increase in the axial length correlate with myopic shift of 3 diopter, also known as spherical myopia, right? So, and every 1 diopter change in the corneal curvature there is steepening of the corneal curvature can lead to 6 diopter of increase in myopia, right? That you also know this very well. So let me put the uh, pointer. Yes. So here you can see two pictures. This is the picture of a or cross-sectional diagram of a normal eye, and this is the cross-sectional diagram of a myopic eye. You can see this myopic eye is quite elongated manner. So this is why light rays are getting focused in front of the retina and they are not able to get focus on the retina. So conventionally, if we find a patient having myopia, so actually we use minus lenses or concave lenses to correct this refractive error, where after putting the concave lenses in front of the eye, then light rays will get focused on the fovea of the retina. Okay, and myopia will get what to say cleared. But some recent research study telling that only correcting the central vision of myopia cannot stop the progression because the peripheral retina or peripheral part of the eye still remain elongated, and we are just only changing the optical focus of the light. So it can lead to myopic progression. So this is why researchers are now most of the time focusing on the ciliary muscle, choroid and sclera to strengthen it, as well as the peripheral defocus theory. Okay, so we will go into everything. So here, this is a type of myopia where actually myopia is three types: axial myopia, curvature myopia, and index myopia. But if I tell about the index myopia, it is quite pathological myopia. So I'm not covering that section. We will only limit it to axial myopia and curvature myopia. Okay, and more the myopia control actually work in this section. This is axial myopia. Okay, and so here this is the management of myopia. If someone found to have myopia, there is two ways to manage it: traditional management and advanced management. Traditional includes spectacles and contact lenses that we routinely give our day-to-day OPD practices. And advanced management include the atropine eye drop 0.01% atropine, myosmart lenses, and orthokeratology. Okay. So in this presentation, I will only cover this atropine 0.01% eye drop myopia management. In the next presentation, I will cover myopia smart lenses, and then I will cover the orthokeratology things. Okay. So let's continue. So here, this is the atropine eye drop therapy. So here, atropine is a medication that works by relaxing the ciliary muscle in your eye, which can help slow down the progression of myopia. So it's particularly effective for moderate to high myopia. However, it is important to know that The atropine can cause side effects like blurring of vision, sensitivity to light, and some patients show psychotic behavior also. So it's typically used under the guidance of an eye specialist. But the concentration of this atropine 0.01, which is used for myopia management, is quite low. So it generally no side effect is seen in most of the cases because the concentration is very low. So it is quite it is seen quite effective. So here, this is the mechanism of action of the atropine eye drop on the eye. So it works by scleral remodeling, growth factor regulation, inhibition of eye elongation, alteration of scleral collagen, and role of choroid also there. So first of all, we will go into deep about everything. Okay, so first of all, we will need to understand the scleral remodeling section. Okay, so here, this is the sclera. What is sclera? Sclera is having three layer part, episclera, sclera, stoma, and lamina fusa, right? So episclera, so this is the outermost layer consists of loose vascularized collagen tissue, and it's where the blood vessels are most prominent in episclera. Then if I go to the stoma, this is a thick, dense fibers middle layer. So this is the main body of the sclera providing structural support and maintaining the shape of the eye. And the lamina fusa, so it is the innermost layer of the sclera, which is made up of thin pigmented connective tissue, and it is adjacent to the choroid and help it in its attachment. So sclera having three parts. So why I am discussing about sclera? Because the atropine work in this scleral remodeling that we are going to understand. First, muscarinic receptor blocking. So atropine is a non-selective antagonist of muscarinic acetylcholine receptor. And these receptors are involved in regulating the ciliary muscle and importantly the scleral remodeling process. So by blocking this receptor, atropine reduces the influence of these cholinergic signals that can promote the eye elongation and scleral growth. And if I tell about the growth factor modulation, so here growth factor is like transforming growth factor beta, TGF beta. So this is a hormone like TGF beta help regulate collagen production in the sclera. Atropine decrease the TGF beta signaling and reducing the stimulation of cells that contribute to scleral elongation so that the scleral integrity will be fixated there. Another is like effect on IGF. What is IGF? Insulin-like growth factor. So IGF plays a role in cell proliferation and matrix synthesis in the sclera. And atropine can alter the level of IGF, decreasing its effect on the scleral growth, which helps slow down the axial elongation by the atropine, low dose atropine. If I tell about the collagen synthesis and organization, here the sclera's structural integrity relies heavily on the collagen fiber than in the stoma part, right? In myopia, the scleral structure is often altered, leading to weaker and more elongated tissue. So atropine has been shown to impact the synthesis and organization of collagen in the sclera. It is seen in various research articles. By reducing the expression of this collagen producing gene, it helps maintain a more stable scleral structure which prevent the excessive elongation of the eye. If I tell about the choroidal response, so here atropine may influence the choroid, which is the vascular layer of the eye located beneath the retina, and changes in the choroidal thickness can have direct impact on the scleral growth. So thick choroid can provide more support and stability to the sclera, right? So counteracting the signals that would lead to elongation. So this is why atropine also work in this manner about the choroid. It also controls the choroid thickness. Another is like inhibition to the scleral remodeling signals. So here atropine may inhibit other signaling pathways involving scleral remodeling, such as those activated by visual stimulus. For instance, under normal conditions, prolonged near work generates signals that promote eye elongation. So by disrupting these signals, through its pharmacological effect, atropine can help stabilize eye growth pattern, limiting the progression of myopia. And lastly, reduction in peripheral defocus. Atropine primarily acting centrally The use of atropine also influences how the eye perceives peripheral defocus. By modifying how light focuses in the peripheral retina, it may change the feedback mechanism that regulates scleral growth. So this alteration helps reduce the stimulus for elongation, contributing further to controlling myopia progression. And this is the peripheral defocus theory. So here, I will give you the basic concept of this peripheral defocus theory. So when a person with myopia look at distant object, the light rays entering to the eye are focused in front of the retina due to the elongated shape of the eye. This results in a blurry image. Not only the central vision affected, but peripheral vision also experience defocus. In myopic eye, peripheral images are focused even further in front of the retina compared to the central image. Now, where is the slide? So this is the slide. Okay. So here, uh, the theory, peripheral defocus theory, point that the peripheral defocus experienced by the myopic eye sends signal to the brain that influence the growth of the eye. Now, peripheral retina is sensitive to defocused images. When it receives this blurred signal, it can promote axial elongation. That means the lengthening of the eye, which exacerbates the myopia. Now, impact of near work here. Prolonged near work, like reading, using screen, can exacerbate these issues. When focusing on a near object, the eye ciliary muscle contract, which also can create peripheral defocus. Now, this additional blur from prolonged near focus may further stimulate the eye elongation. So here the question: why myopic defocus lead to elongation if rather than shortening of the length of the eye? Here, first, defocused peripheral vision. In myopic eye, light rays are getting focused in front of the retina, uh, causing both central and peripheral image to be blurred. Peripheral retina, in particular, is sensitive to this defocus. Now, their working is feedback mechanism. The eye operates on a feedback mechanism. The brain monitors visual input and adjusts the eye growth accordingly. When the peripheral retina detects defocused images, it interprets these signals as an indication that eye is not adequately focused on distant objects. Now here the growth signal. The peripheral retina sends biochemical signal that promote the eye elongation. This occurs because the brain interprets that defocus as a need for the eye to grow longer or grow more to achieve a clearer distant vision. Now, essentially, the brain thinks that the eye needs to stretch or elongate to bring the peripheral image into focus, even though this leads to worsening of the myopia. So, here, why shortening has not happened? Because lack of shortening mechanism, only elongation mechanism is there. So there is no evident mechanism that signals the eye to shorten when distant object is blurred. Instead, the signal associated with defocus primarily promote elongation. So this way, feedback loop can lead to cycle where more myopic an individual become, the more signals are sent to elongate the eye. Here also role of accommodation. When focusing a near object, the eye ciliary muscle contract leading to increased accommodation. This can also create additional peripheral defocus, reinforcing the signals for axial elongation. So this is my references. You can copy and you can study those things also. So thank you so much for your kind listening. And in the next video, I will cover the myosmart lenses mechanism. Thank you so much.